Hello, Dr. Byrak, and everybody with us today. I just want to go ahead and thank everybody for joining our webinar today. It looks like we have about a few of us with us here tonight. So thank you. I just want to say that we are LA Fertility Center, and you have joined our evening webinar. And our topic for today is how to improve your fertility on your own. But before we begin, I want to start with introductions. My name is Araba. I am the Practice Relations Director here at LAIVF. And joining me is Dr. Aikut Bayrak. He is the medical director here at LAIVF, and he has been in private practice since 2005, and he is a double board certified fertility specialist. Welcome, Dr. Bayrak.
Thank you, Arba. Thank you.
Thank you. And I want to also include just a little bit about LAIVF and what we're all about. We have 4 locations in West Los Angeles, Pasadena, Chino Hills, and San Diego. We offer a wide variety of fertility treatments, and we are known for our individualized care. We don't have a one-size-fits-all approach to our treatment. We take an individual approach to all of our care. And with that said, I want to go ahead and get started. I do want to encourage everybody who is attending our webinar to please ask any questions. You can put your questions in the chat. You can type it into the chat portion, and I can read them out. But feel free at any time to ask anything you need. So Dr. Bayrak, I would like to get started. Yes. Let's go ahead and get started kind of with an overall picture of what females can do for their fertility and what males can do. And then I also want to talk about the different types of testing that they can do on their own as well.
Absolutely. So let's start with that. This is a really important topic because sometimes with minor adjustments, a couple actually can get pregnant and they may not need full-blown fertility treatment. And we do see that fairly frequently in our practice. One thing that we typically talk about is lifestyle. In today's world, we live in a very stressful environment, and certainly that stress has a significant impact on not only fertility but our general health. And anything that we can do to improve our stress management or lower our stress level would be beneficial. On the male side, stress certainly can affect testosterone levels. It has been shown by many studies that men who are under high stress have low testosterone levels. So our body actually tends to produce less testosterone. Well, as we get older, certainly, because there's reproductive aging, but also stress does affect testosterone. And testosterone is obviously the most important reproductive hormone in males, and our body needs testosterone to produce sperm. If there's no testosterone, there won't be any sperm production. So this is such a crucial and important variable in fertility overall, and especially in male fertility, that just simply by managing stress, we can boost our testosterone levels, which then in turn will improve sperm parameters. So just something that simply we can do easily. Sleep is very important, and that is the case for both men and women. It
Mhm.
has been shown that men and women who sleep equal to or less than 6 hours actually may have health issues. And that can include abnormal hormone production, which includes reproductive hormones.
Mm.
And that can lead to increased stress in the body, which then affects the immune system. And
Mm.
as we all know right now, immune system is very closely related to the reproductive system,
Mm.
which can affect ovulation in women. It can also result in suboptimal ovulation in somebody who has regular cycles, or absence of ovulation in some cases.
Wow.
So that kind of rhythm is important, and that's why we recommend all of our patients to have a good sleep habit in a way,
Mm.
and not to consume excessive amounts of caffeine.
Mm.
And that just cannot just be in the evening, but rather starting in the late afternoon. So we really need to limit our caffeine intake starting in the late afternoon, because caffeine has a very long half-life. It does stay in our body for a while. So if you have a cup of coffee at 2 o'clock in the afternoon, that's
Mm.
going to stay in your system until 2 a.m.
Wow.
So that's why it's really important to limit caffeine, or caffeinated beverages, we should say, because there are other drinks or beverages that certainly contain caffeine. So it just cannot be caffeine only, especially
Oh.
with energy drinks. I think there are a lot of energy drinks that contain high
Mm.
levels of caffeine, and sometimes people take or tend to drink those either in the evenings or in the late afternoon, which can certainly affect things. So I think lifestyle is important. Sleep is
Mhm.
extremely important.
And
Stress
Dr. Byrak,
management
before you go any further, how much is too much caffeine? Somebody is one of our guests is asking.
is asking. That's a valid and good question. So typically, we typically say do not exceed 3 servings of caffeine per day.
Oh wow. Okay.
And each serving that somewhat ranges anywhere between 50 to 100 milligrams of caffeine. Even if you're over 100, 150, 200 range, that's considered to be somewhat high. So when we
Okay.
say caffeine, obviously, we have a lot of coffee houses these days, right? So it
Mhm.
depends on what type of coffee it is, how it's brewed, and is it
Mhm.
light roasted and heavy and all of that. So each cup of coffee is not the same, obviously.
Mm.
The coffee that we may be making at home may have less caffeine than some of these coffee houses that we go to on a regular basis, where a shot of caffeine may even contain up to 150 milligrams of caffeine. So even like one shot or one serving of 12 ounce or 16 ounce of caffeine may actually just be enough for that day. So it's just we just simply can't say just a cup in a way, but rather talk about the amount. So I think a safe way to
Mm.
go is to limit to up to 2 caffeinated beverages per day, and with that, I think we would be limiting our caffeine intake. Obviously, there are other types of foods and drinks like energy drinks,
Mm.
tea, hot tea. Certainly, black tea has caffeine in it. Herbal teas, they obviously don't. So herbal teas are certainly safe, but any kind of sodas that contain
Mm.
caffeine also count as caffeine intake. So it's just not coffee, obviously.
Mm.
So I would say safe is probably up to two, 3 and greater, maybe a little borderline. Certainly, higher number of cups of coffee or caffeinated drinks will lower the fertility rates, and also it actually can increase miscarriage rates,
Oh.
which can be pretty dramatic. In men, also same, it can actually affect fertility. So I would say no more than three, probably 1 to 2 is in the ideal range.
Okay.
So I think we did answer that question. So let's continue on with the
Mhm.
lifestyle modifications. We talked about stress, how stress management is important. We talked about caffeine just now because we had a question. We talked about sleep. And next, why don't we talk about diet? Because diet is something that affects everybody. And it can
Mhm.
affect not only the reproductive system, but also our entire body. So, as they say, you are what you eat.
Mhm.
That is certainly true, and
Mhm.
that does affect our entire body. And we have all experienced times where we have gained weight, or we were stressed out, or we had really a lot of bad food or fast food, and at the end, we feel tired. We feel like we have lost our energy.
Mhm.
Sometimes people cannot sleep well. It affects our skin. It affects our gastrointestinal system. One thing that we don't know how it affects immediately is the reproductive system because the reproductive system really does not give any symptoms. And that's kind of one difficult or challenging part of diet and its impact. Um, so in terms of diet, I always say we should all keep a balanced diet. A balanced diet constitutes a balance of carbohydrates, proteins, and also healthy fats.
Mhm.
Proteins can be in the form of biological or animal proteins, like the ones we get from red meat, fish, or chicken, pork, or other types of animal products. It can also come from vegetables, obviously. Beans typically have very high vegetable protein content, as well as lentil. There are other food groups that also provide protein, but those are the two main groups. So if
Mhm.
somebody is vegetarian or vegan, certainly they can still get the protein from those vegetarian sources. If somebody is enjoying meat products, that is certainly a good way to um, uh, get protein in our body. But it
Mhm.
just cannot be just protein only. It has to be a balance of carbohydrates. Oftentimes, complex carbohydrates are healthier than simple carbohydrates or simple sugars in a way. So one has to pay attention and prefer more whole wheats compared to processed flour or processed type of rice or bread. Typically, whole wheat is generally considered to be healthier.
Mhm.
And last not least is type of fats. There are many different type of fats. There are saturated fats. There are polyunsaturated fats. There are monounsaturated fats, and then there's saturated fats. So typically, saturated fats are unhealthy. They're not
Mhm.
only unhealthy for our general body, but just in terms of the reproductive system as well as the cardiovascular system.
Mhm.
So it has to be a balance between unsaturated fats such as fish oil or oils that we get from any kind of fish products. They're also commercially available, such as omega-3, right?
Mhm.
But also liquid type of fats are always better than the solid ones, such as olive oil.
Hmm.
Olive oil actually is probably one of the healthiest type of oils or the fats that our body kind of needs.
Wow.
As we all know, olive oil is heavily consumed in the Mediterranean countries,
Mhm.
and there are a number of studies now, actually, interesting enough, Araba, that women who are pregnant or women who are trying to have a baby
Mhm.
actually benefit from consuming a Mediterranean type of diet.
Interesting.
And for those of us who don't know the details of the Mediterranean diet consists of a balanced diet. So
Mhm.
people in the Mediterranean, they eat well, fats and saturated fats and fish and fresh fruits and vegetables and so forth. But their food is really more heavy on not so much processed foods, but rather fresh cooked food.
Mhm.
They're typically low
Yes.
in saturated fats, and I
Huh.
think that's one of the keys. There's less fried foods. That's another
Mhm.
variable, I think. And also, there are a lot of fresh vegetables. that are served fresh and sometimes even raw. So I
Oh.
think those are some of the variables and important or that are present in the Mediterranean diet that probably makes it a better type of diet, not only for women who are pregnant, but also for those who are trying to get pregnant. So
Mm.
that's something that we should probably embrace further because our diet on this side of the ocean is certainly not a healthy one. And we all should be we all should be paying attention to that. So keeping the diet balanced, that is rich in
Mhm.
vegetables, balancing out protein and carbohydrates and unsaturated fats is really the way to go. And the
Okay.
last but not least is exercise. We
Mm.
all should exercise. We probably should all exercise more, right? I mean, that goes without saying. But that doesn't necessarily mean that we have to be in the gym every morning at 6 a.m., but rather balance our activities during the day. And that simply can be walking before or after dinner. It can be at our lunch break if we have a lunch break, um, or early in the morning, and that doesn't have to be once again aggressive or I mean it's not necessarily that we all have to train in a gym or in a controlled environment. It can be any type of activity, maybe once on a weekday, maybe once on
Mm.
the weekends. That can be anything from organized sports to working out in a gym or simply
Mhm.
taking a walk or going for a hike or whatever is available. Any kind of activity that's going to increase the heart rate for approximately 30 to
Mhm.
45 minutes, 2 to 3 times a week. And once again, that can be any kind of activity. I know I have friends who don't have time, and when they work in a high-rise building, they actually just go up and down the stairs for 5 to 10 minutes.
Oh.
I know I have friends who have done that, and that works. So as long as we're
Mhm.
active at some level, that's going to not only boost our immune system, but it's also going to improve the circulation in our body. It's going
Mm.
to connect our body and our brain, where that kind of a connection will be reestablished. Even
Mm.
on stressful days, sometimes there's some disconnect, and that's certainly an important one to establish. Furthermore, when there's more blood flow or better blood flow to the tissue, then such as ovaries and the uterus, where we have the eggs and implantation takes place,
Mm.
including where the sperm is produced, right, in testicular tissue. There's better oxygenation. There are more nutrients that go to those important reproductive organs, and also some of the toxins are removed from those organs. So exercise not only
Mm.
balances the mood and improves just general health. It's extremely important for the cardiovascular system, which also feeds our reproductive organs, but also overall allows us to lead a healthier life, which then improves our reproductive health as well. So I think
Mm.
those are all the important points
Uh-huh.
of lifestyle modifications. And I think there is one
And
question there about, if I'm not
yes.
mistaken, um,
Um, yes, we have a question here that this person is on a night schedule and doesn't sleep at night, but sleeps 5 to 6 hours in the morning. How can she or he work around that kind of schedule, do you think?
right. So the question is, instead of sleeping at night, if somebody's sleeping in the mornings, how is that going to affect things? That's certainly going to affect things. Number one, I mean that's the short answer to that question. How much is it going to affect? That's difficult to predict.
Mm.
Um, as long as this person who's asking the question can balance out her diet, boost her immune system, manage stress, and somewhat have some exercise activity, that may balance the um, the challenge that she's having from working nights and sleeping in the mornings. Certainly, people who work at nights or do night shifts, people who are in aviation, working kind of different time zones can certainly have reproductive issues. That's certainly something that has been established. So um, the um, the most important aspect that's affected with that is probably ovulation, because when we are tired, when we're traveling, when we're in a different time zone, or when we're awake when we're supposed to sleep, which is nighttime for all living creatures pretty much, including humans, and when we are trying to sleep during the daytime when we're supposed to be awake, that certainly will affect the reproductive system. Yeah, that's certainly a challenge.
Mm.
Anything that can be done to modify that would be helpful, certainly.
Mhm.
But if somebody's job requires that, let's say you're a nurse and you're doing night shift at the hospital, you're a physician, you're working the nights. I mean, I certainly know that myself. For many years, I was on call almost every night, every other night, every third night, and that certainly affects your normal rhythm.
Mm.
So those are certainly challenges, but not things that are not unmanageable, obviously. So I think if somebody's having difficulty conceiving and they're concerned about working the nights, I think a good idea maybe just to do a basic workup. Maybe check the hormone levels if
Mm.
something is affected. Check the sperm if that person has a partner, or if there's a suspicion of any sperm issues. Perhaps check the fallopian tubes and the ovaries at the same time, as well as the uterus. So do a basic workup to make sure
Mm.
this type of a lifestyle is not affecting something dramatically. So I think a workup in such a case would be warranted, and perhaps some
Mm.
type of support or a certain hormone therapy can actually be helpful in those cases. So that's what I would recommend for this participant and her question.
Okay, fantastic. And that leads me to the next question, which is what type of testing do you suggest to get an idea of, um, what the baseline is and where that person might be, according to.
Sure. So this question here is asking us what kind of workup, or the basic workup, we should say. I think that would be in order to better understand what's happening with that person. So the basic workup in infertility includes a semen analysis. So we like to test the sperm
Mhm.
to make sure that there's no a quantitative problem, meaning there's enough sperm that are moving around. In some cases, we do check the sperm DNA. And as a matter of fact, we do offer that through our laboratories. We have validated assays that we can actually check to see if there are sperm DNA problems, which is something that's important, that can certainly cause dramatic issues. But the basic workup would include immediately a semen analysis. The second thing that must be done, especially in cases where it's early infertility or somebody's trying to improve lifestyle and cure the disease that way, checking ovulation is important. That can be done by history taking, obviously, documentation of ovulation by ovulation predictor kits, as well as checking progesterone hormone levels 1 week after ovulation. And that would be important, just like the individual who's asking the question, who's working nights, or somebody who's really not sure whether she's ovulating or not. That would be important to document, because if you're not ovulating, you're not going to get pregnant. I mean, it's
Mm.
simple as that. Or just by definition, if somebody has irregular periods, if somebody comes in and says, I get my periods every 2 months or every 3 months.
Mm.
I actually saw two patients like that today in my office,
Mm.
and they obviously have ovulation issues. And then, last not least, is checking the fallopian tubes and the uterus. So it's really important that we document a healthy uterus where implantation takes place, and also check the fallopian tubes and make sure that the fallopian tubes are open. And that can be done through a basic X-ray test. It's called HSG in medical terms, or hysterosalpingogram. It's commonly known as the dye test because the radiologists do it and they inject the dye. And that would constitute the basic workup of infertility. And if
Mhm.
there's any other advanced testing needed, obviously we do offer that to our clinics as well. But with that, we'll be able to diagnose the issue in a majority of the cases. If there's something that's unexplained, we don't like that term. We want to explain everything, and that may require additional testing that, such as a sperm DNA test that we do offer at our clinics and our
Mhm.
laboratories. And that would be one thing that we typically would recommend. To sum it up, I think a semen analysis, documentation of ovulation, checking hormone levels, doing the basic workup, and testing of the tubes and the uterus would be recommended for those patients, Arba.
Okay, good, good, good. And also, I wanted to talk about our fertile vitamin line. We also have offer fertile vitamins, which is we have male, female, and vitamin D, as well as fish oil to kind of help supplement as far as dietary needs.
That's correct. Yes, our clinic and myself actually developed fertility vitamins for men and women.
Hmm.
The reason why we did that was the lack of a supplement, a dietary supplement that really needed to fit the needs of the patient population that we treat. And almost every single day, patients ask me and have been asking me, which supplement should I take? Which is the
Hmm.
best male supplement? Which is the best female supplement? Should I take a prenatal vitamin? Should I take a multivitamin? Patients say, okay, I found a vitamin that has everything from A to Z, but is that way too much for me? So there are all these questions that have come up over the years, which then led me to start working on certain formulas where we gather information not only from the industry but also based on medical evidence, and have created these vitamins, these dietary fertility supplements that are specifically designed for women who are trying to conceive or who have infertility, as well as those men who have abnormal sperm parameters. So I think we're in the third or fourth generation now of the vitamins as of this
Hmm.
year. The vitamins include necessary supplements such as vitamins, minerals, but more importantly, things that are recommended to take during pregnancy, such as folic acid and vitamin D,
Mm.
as well as iron. And these are important supplements because we do have an unbalanced diet. Majority of us have an unbalanced diet, so we're missing some parts of these essential nutrients. And when somebody's preparing for pregnancy, that is so important because the health of the child and the entire outcome of the pregnancy sometimes can be simply dependent on diet. And that will be pronounced if somebody has a very poor diet or if somebody has really poor habits. So that's why we have fertile vitamin for men and women, as well as omega 3 vitamin D3, as well as fish oil. So we do offer that through not only our offices, but also through fertilevitamin.com. So anybody can go from anywhere in the country and order fertile vitamins online and receive them within a week or so. The fertile vitamin for women is really a prenatal formula with a boost of antioxidants that have been recommended for better reproductive health. And our goal is really to improve just the general well being, supplement any missing nutrients, and hopefully improve the egg quality and overall outcome of the pregnancy. Those are our goals. On the male side, the fertile vitamin for men is a very heavy combination and extensive combination of antioxidants
Mhm.
and minerals, as well as some vitamins. So it is the most comprehensive supplement that we know that
Mhm.
exists today. And those are recommended for men who have abnormal semen parameters.
Mhm.
And the ingredients within that supplement have been shown by medical studies to improve those parameters. So we do include nutrients as well as supplements that are inside this formula that have been shown to improve parameters by medical studies. And fish oil is recommended for pregnant women. There is some suggestion that fetal brain development may be better with an increase in
Mhm.
the fish oil consumption or fish consumption. Let's not all forget, obviously, that the best way to get our nutrients are from food products,
Mm.
fresh food products.
Mm.
That will be ideal, but certainly we don't have an ideal diet. And I'll be the
Mhm.
first one to admit that sometimes I don't have a good diet, and this would be especially important in women who are trying to conceive. So these vitamins are really recommended to start at least 3 to 6 months before a planned pregnancy. Actually, the American College of Obstetricians and Gynecologists recommend a balanced diet, and also they recommend consumption of folic acid either alone or in the form of a prenatal formula
Mhm.
prior to a planned pregnancy. And we typically recommend that to be started at least 3 to 6 months.
Oh, really? Okay.
Right, especially there is a pretty significant birth defect called neural tube defects, commonly known as spina bifida, which is a type of neural tube defect. And if somebody takes folic acid every day in the form of either a vitamin supplement, a dietary supplement, or from fresh foods and so forth, the risk of having a neural tube defect will decrease, and that's
Mm.
evidence based. So there are many other obviously benefits of taking supplements, especially in somebody who has an unbalanced diet. So to sum it up, supplements are extremely important because most of us have an unbalanced diet, so we're missing a lot of minerals and nutrients, especially in somebody who's trying to become pregnant. And these formulas are recommended prior to pregnancy, during the pregnancy, and also while breastfeeding or breast pumping.
Mm.
Because once we complete the pregnancy, we're still not done,
Mm.
right? We have to provide milk, and most women breastfeed or pump, or
Mhm.
the combination of the two,
Mhm.
and we still need to continue vitamin supplements or have a good, perfect, balanced diet during those times. But these vitamins are available through fertilevitamin.com or through any LAIVF clinic locations.
Perfect, perfect. Dr. Byrak, we are starting to wrap up. However, I do have a question that's a little off topic, but I uh, do think it's important. Someone is asking if they happen to not have fertility issues, already have a couple of kids, but they want to have a third, and do gender selection. Is the IVF process still the same in that case?
Yes, it's same, if not extremely similar.
Mhm.
If somebody is trying to balance their family, they have two girls, they want a boy, or vice versa. The IVF treatment is kind of the same. One has to use hormone therapy for 7 to 10 days, develop multiple eggs, which are then aspirated. They are then fertilized with sperm,
Mhm.
and then they're developed into embryos, and then they are tested through this genetic testing called PGT, pre-implantation genetic testing, which then will reveal not only the gender but also the chromosomal issues that may result in birth defects, Down syndrome, Turner syndrome, other chromosomal issues, which then will allow this couple to balance their family. So that would be the way to do it. When somebody does IVF, they don't necessarily need to do genetic testing, but they they have to they can consider, at least, let's put it that way, about testing their embryos. And it's not a must that they test the embryos, but majority of the patients nowadays do test the embryos.
Mhm.
So even though typical or conventional IVF does not include or incorporate genetic testing of the embryos, it is fairly commonly done these days. But that would be one way to determine the gender, which is, I think, um, um, this participant is asking us. So it's
Okay.
very, very similar with the addition of the embryo test.
Okay. Well, thank you for that. And I just want to just give one more moment of opportunity if in case anybody is wants to ask a question. We are going to wrap up. Oh, I do have one question down here. Um, this couple had two semen analysis testing done, and they were a year. Each test was a year apart, um,
Okay.
and they both tests came back with no semen in the sperm. What would be the next step for somebody in that issue with that issue?
So it looks like this couple or the gentleman has something called azoospermia, which is absence of
Mm,
sperm in the ejaculate. That can be due to a variety of different reasons. Typically, there are two major categories. One is due to obstruction, where the male tubes are blocked, where the sperm is being produced, but it's
mm,
just not coming out mechanically. So
mm.
that's called obstructive azoospermia, or having no sperm due to blockage. The other reason can be non-obstructive, meaning the tubes of the men are open and everything's fine, but the sperm is not coming out, which is oftentimes due to the production of sperm. And those men need an evaluation, an examination, hormone testing, and in some cases, they may need chromosome testing as well as genetic screening, because some of these issues can be related to certain genetic disorders, and some men may be carrier of this disease called cystic fibrosis.
Mm.
So we evaluate each of those men and do the necessary testing based on their needs. And oftentimes, these men will need a testicular biopsy.
Okay.
And through the testicular biopsy, we'll be able to find sperm, not in all men, but in
Mm,
some men who are still producing some sperm in the testicular tissue, even if it's not coming out. If there's production, we can actually find that sperm. But
mm,
but then men have to undergo a minor procedure called microscopic testicular biopsy.
mm,
So with that technique, we should be able to obtain sperm. If that fails, or if there's absolutely no sperm production, or there is a significant genetic issue, then the use of donor sperm obviously is always an
mm,
option. But that is always the last resort, obviously. So I would recommend for this gentleman to have a consultation and
mm.
a workup. That's what they need.
Gotcha. Okay. I just want to check one more time to see if we have any other. Oh, we do. Um,
You have one more question. Let's.
this is yes, a good question. What role does alcohol play for both the male and female in a gender fertility test, if at all?
So alcohol, if consumed socially, does not have an impact on fertility, sperm parameters, or equality.
Okay.
It's dose dependent. So if somebody's having one or two drinks per week, or 3 to 4 per week, if it's more on the weekends, that's not going to affect anything at all. But if somebody is drinking on a regular basis every day, and if it's
Mm,
1 to 2 or more drinks, that can affect the egg quality, that can affect the sperm quality, can affect the sperm quantity,
mm,
um, and that can affect also implantation.
hmm,
Also, women who drink while they're on the hormone therapy, whether that's for insemination, ovulation induction, or IVF treatment, or for egg freezing, whatever the reason might be, they tend to have lower success rates.
oh.
Right. So during active hormone treatment, we do recommend women avoid alcohol intake.
Mm,
And just in general, if it's moderate to high alcohol intake in terms of lifestyle or whatever reason may be, that can affect um, reproductive system and the overall outcome. In terms of the test results, I don't know if the question is asking specifically about the test results. Um, if the alcohol intake affected the eggs or the testicular tissue, egg quality, egg quantity, sperm quality, sperm quantity, certainly those tests are going to be abnormal. There's absolutely no doubt about that. But it won't affect the tubes
hmm,
or the uterus. So if somebody's drinking heavily, for example, if their tubes are open, they're going to be
hmm,
open. Alcohol won't change anything. But everything else can be affected. So that's actually good.
hmm,
That's actually an interesting question. I don't think I've got that question for a long time. But that's a nice, valid question.
hmm.
Actually, thank you for asking that question. Very
Yes.
important.
Any other questions from our viewers? I just want to give one more opportunity. It doesn't look like it. Uh, well, I do want to
Okay.
thank everybody for joining us today. And I want to remind you that because you joined our webinar, you do get a free consultation with Dr. Byrak. So we'll be scheduling that in the next couple of days with you. So thank you for joining us. And I do also want to say that we are offering 10% off your IVF treatment as well. If you schedule with us within 3 months of your appointment date, you will also get that as well. Um, so if there's nothing else, Dr. Byrak, I want to say thank you for joining me and thank you to everyone else as well.
Thank you so much, Arba. It's, I think, been a very educational session tonight. There were really
Yes.
great questions, actually, and original questions. So that's really valid. Thank you so much, and we'll see everybody at the next webinar
Okay,
or our
awesome.
in-house
Thank you, Dr.
seminars.
Byrak. Have a great night, everyone. Bye bye.